Positive Behavior Interventions and Support Organization has developed a framework for school staff to engage children through a three-tier positive behavior support intensity. Through this organization, 27 New York City counties and boroughs implement this program, which stays active in each individual school for 3 years. The time frame given enables the ability to train the proper staff and to provide support to ensure the quality of services are given to the children. Another organization is the New York City Turnaround Program. This nonprofit group works with high poverty, underperforming schools to create sustainable environments conducive to effective teaching and learning. The program collaborates with schools for a period of 3 to 5 years, gradually developing a school's capacity to address its students' social, emotional, and academic needs. Improving the rigor and effectiveness of preventive interventions can mitigate or eliminate the onset of selected disorders, especially during these early stages of development. Additionally, interest has increased in promoting prevention practices as well as fostering interventions that can lead to positive mental health among children, youth, and young adults. Child Health Plus is a New York State-sponsored health insurance program for children under 19 years of age that do not qualify for Medicaid and does not have any other form of health insurance. This service is extended to those families and children that needs to see doctors or needs medicine for little to no cost at all. It is based off of the household income and does not require for any co-payments for the services they receive. The Health First service includes New York City, which includes Brooklyn, Bronx, Manhattan, Queens, Staten Island, and Long Island, in which under the insurance program, your child will be able to receive coverage for checkups, baby and early childhood shots, vaccines, emergency care, hospital stays, medicine, and other health services. Behavioral health organizations have been increasingly required to implement plans to monitor and improve services to children with mental health illnesses. With these disorders amongst children and youth, they threaten the health and well-being of the younger population, which often carry over into adulthood. The New York City Department of Education has collaborated with several mental health agencies to bring mental health resources into schools. These programs facilitate school staff with the tools to educate and support mentally challenged and behavioral problematic students during the school year. Other New York City programs are sponsored and funded by the state, provide New York City children with continuous mental health services throughout the year. These prevention practices have emerged in a variety of settings which not only include school-based services but also interventions in primary care settings as well as community services that are designed to address a broad array of mental health needs and populations. As we have established before, children's mental health and abuse has been and still is a major concern for New York City, and they are taking active leaps to amend this concern. Some of those concerns circle around foster care because children in foster care are more likely to develop some kind of mental illness. Being exposed to trauma and falling into the system usually involves protective services. It is important to address any behavioral issues as they arise to help avoid bigger problems as they get older. As we know, mental health issues are now being identified in child psychiatric, and the state of New York has services to help with children that are being abused. It is proven that children do their most crucial growth from 0 to 5 years of age, and how they are treated is and will affect their mental health. Therefore, we need to help children. We need to engage the children and their families, helping them to treat and plan and decide which services are suitable for them. Many strides have been taken to ensure that all children have access to quality mental health services. Several programs have been implemented, and within these programs, they facilitate school staff with the tools to educate and support mentally challenged and behavioral problematic students during the school year, only bringing to the forefront the leaps and the bounds New York City is and has taken in order to secure their city's children with the help that they need. In conclusion, mental health is a concern nationwide in any age of human being. It is astounding to see what New York City has accomplished and plans to accomplish through ideas and innovations to help the children of New York City. Through federally funded programs as well as nonprofit programs, there is an extensive amount of help for those children battling with any kind of mental illness. Mental illness can stem from all sorts of situations, whether it is a condition they were born with, or through other abuse, or even due to poverty, misplacements, or when tragedy strikes such as 9/11, mental illness is apparent and a problem. The point is, there is help out there, and when many of this help is being promoted through the children's schools, there is no reason why each and every child should be to retain the help they need. It is rather refreshing to know such a city is truly trying their best to help their children grow and prosper. They are the future, and with that in mind, a city should want nothing but the best for their future.